Health anxiety can be an extremely debilitating and distressing psychological condition in which a person worries excessively about their health and the possibility that they might have a serious health condition. Today's video continues our series of videos building an understanding of health anxiety and why it happens. And in today's video, we're going to be talking about 5 factors that can fuel and drive a person's worry about their health. But before I get into that, just a couple of disclaimers to go over. I'm a registered psychologist in the province of British Columbia, Canada, and this video is for informational purposes only. It is not intended as a substitute or replacement for advice from your doctor or mental health professional. Now, with those things out of the way, let's start talking about health anxiety. And as I mentioned earlier, this video is a continuation of our series of videos focusing on health anxiety. And if you haven't had a chance to take a look at the previous videos in this series, I'd strongly encourage you to take a look at them as they'll help give you a broader understanding and context for today's video. And in our last video, I talked about how factors that lead a person to be at greater risk of developing health anxiety can come alive when triggered by various internal and external triggers. So what happens once a person's health anxiety gets triggered? Does it just go away on its own? And if it doesn't go away on its own, what keeps it going? Well, there are 5 main factors that can fuel and keep health anxiety going. The first of these is unhelpful or negative thinking patterns related to a person's health. People who are prone to health anxiety have a number of unhelpful rules or assumptions about their health that get activated by various triggers. And these unhelpful rules and assumptions affect how we interpret health information. People with health anxiety generally tend to overestimate the likelihood that they have a serious health problem, and they tend to underestimate their ability to cope with health difficulties. In health anxiety, what also tends to happen is that people tend to put much less weight on information that suggests things aren't as bad as the health anxiety would suggest. So, for example, a person with health anxiety may ignore their doctor's reassurance that it's extremely unlikely that they have a serious illness, but rather the person may focus on all of the negative, less likely worst-case scenario information than the chances of a cure or effective treatment. As a result, all health-related experiences are viewed in the lens of a catastrophe or a worst-case scenario. And what this does is it affects 2 broad areas. The first is a tendency for a person to catastrophically misinterpret body sensations. So, for example, if I hold an underlying belief that any pain, discomfort, or unusual body changes are a sign of something serious underlying some serious underlying disease. What this means is that when I start to notice that new pain in my joints, I may come up with a catastrophic interpretation or understanding of what that pain means. Maybe this is bone cancer. Maybe this is the start of a serious arthritic condition. This could be something incurable. Maybe it's cancer that's spread to other parts of my body. Now notice, none of these catastrophic things have happened, but the way I interpret those physical sensations is leading me to believe that these catastrophic things are likely, if not a certainty, to happen. The other thing that can happen is that people tend to catastrophically misinterpret health-related information. What this does is it leads to people feeling that they're at higher risk of something really bad happening than they actually are. So, for example, suppose I've been feeling unwell for a week or so, and I know I should go see my doctor to get it checked out. So I go to the doctor does some blood work and tells me that the test results indicated that I have a low white blood cell count. But then the doctor goes on to tell me it's probably just due to the fact that I have a cold. Well, if one of my underlying assumptions or beliefs about my health is that my doctor needs to be 100% certain of what the problem is, if my doctor's not sure what's causing the low white blood cell count, then it must be really serious. So my doctor said the low white blood cell count is probably due to the fact that I have a cold, but maybe my doctor's actually wrong. And maybe what I have is leukemia, or maybe it's something that my doctor hasn't tested for, like lupus or some other autoimmune condition. So notice what's happening is that I'm taking this information from my doctor and I'm interpreting it in a catastrophic way to make me feel even more anxious about my health. Now, the second big factor that can maintain and perpetuate health anxiety symptoms is when a person experiences an increase in anxiety symptoms themselves. Think about it. If I start to have catastrophic thoughts about my bodily sensations, I start to think that I might have bone cancer, I start to think that my doctor's not sure what's going on, and so it must be some really awful neurological condition that's going to kill me slowly. If I'm having these thoughts, how do you think that's going to make me feel? Well, those thoughts are probably going to trigger a whole lot of anxiety, which then activates my body's fight or flight reaction. My anxiety system is going to kick in, and this is going to trigger a whole set of physical responses and physical reactions. I've talked about this in previous videos that I've done on panic disorder, that our body's anxiety system is designed to make us temporarily stronger or faster to either fight a physical threat or to run away from it. So what happens when we experience high levels of anxiety is that we can experience a number of associated physical reactions. Things like increased heart rate, muscle tension, increased respiration rate, dizziness or lightheadedness, numbness and tingling in my fingers or my toes, increased sweating, hot flushes, chills, blurred vision, upset stomach, all of these types of things. Now, these symptoms or sensations are all part of the body's natural alarm system that's designed to activate us in the face of an actual physical threat. But in the case of health anxiety, my thoughts are revolving around perceived danger, not actual physical threat. So if I'm thinking that my knee pain is bone cancer and that's going to be incurable, leading to death, that's a perceived danger. It's not something that's actually happening, and it may never happen. But if I have these thoughts, it makes me more anxious, it triggers my fight or flight reaction and brings on these physical sensations of anxiety, which now serve as other physical symptoms that my health anxiety will get me to catastrophically misinterpret. My health anxiety will tell me that the symptoms of anxiety are just another sign of something being seriously wrong with my health. And what this does is it leads to a vicious cycle where a benign physical symptom like an ache in my knee triggers catastrophic thoughts about awful health problems that I may have, which in turn triggers anxiety symptoms, which lead to even more catastrophic thoughts about my health, triggering even more anxiety symptoms, and so on, and so on. Now, the third big factor that can contribute to making health anxiety worse or keeping it going relates to focusing or paying attention to certain bodily symptoms or sensations. If I'm really concerned about the pain in my knee and the possibility that it could be bone cancer, I'm likely to spend a lot of time focusing and thinking about the pain. I may check in with it every morning to see, is it getting worse? Is it spreading to other parts of my leg? Is the pain subjectively different? Is it more throbbing pain? Is it more of a sharp pain now? The more I focus on the pain, the more I'm going to notice all sorts of small, nuanced peculiarities of that pain. I'm going to notice all of the things that I probably wouldn't have noticed if I wasn't paying so much attention to it. And then I interpret these newly noticed aspects of the pain as a sign of something bad. Now, the other thing that can happen when we focus on a physical symptom is that focusing on the symptom can actually amplify the intensity of the symptom. And if the intensity of the symptom increases, that can trigger even more anxiety about the symptom, which requires me to then pay more attention to it, which amplifies the intensity of the symptom, and now I'm in another negative spiral of anxiety. To explain this, I want you to pay close attention to what's going on in your stomach right now. Try to notice all of the little sensations that you can feel and that you can notice in your stomach. If your stomach feels full or if it feels empty, is there any tightness or gurgling sensations in your stomach? Just really try to pay attention to what your stomach feels like right now. And if you were to spend even just a minute doing this, what you might notice is all sorts of physical sensations or symptoms in your stomach that you may not have noticed before. Now, the thing is, the sensations were there all the time. They've always been there, but you just weren't paying attention to them, and so you didn't even really notice them. The moment you pay attention to those symptoms and focus on them, you begin to notice them, and the symptoms themselves seem much more intense than they were even just 2 minutes ago when you weren't paying attention to them at all. So it's important to recognize that focusing on the particular sensations or feared symptom can actually serve to make the health anxiety worse because it amplifies the intensity of the symptom merely by the fact that you're paying attention to it. Now, the next big factor that can perpetuate and drive and fuel health anxiety relates to checking and reassurance-seeking behaviors. Now, the thing is, if you worry about something, it's natural to want to check or seek reassurance about it. If I'm concerned that I might have not locked the front door, that might lead me to feel anxious. And so I go down and I check the front door. Once I see that it's locked, I feel less concerned and my anxiety goes away. So checking and reassurance seeking is pretty natural. And with regards to our health, we're often encouraged to check and pay attention to our bodies. We're often encouraged to monitor moles on our skin for any signs of change. Women are frequently encouraged to do breast exams and to get regular mammograms to check to make sure that there are no cancers developing. If we're concerned about our health or notice any changes in our general well-being, we're encouraged to reach out to our family physician just to get checked out and to make sure that nothing is wrong. So, checking and reassurance seeking, in and of itself, is not a bad thing. But it does become problematic when it starts to become excessive. For people with health anxiety, they may notice these physical sensations or symptoms, and it makes them feel really anxious, and they start to worry about their health and worry about the symptom. And so the person with health anxiety engages in repeated or ongoing checking and reassurance seeking as a way of trying to reduce their anxiety or worry about their health. The hope is that each time they check or seek reassurance from their doctor and they notice that the symptom hasn't changed or their doctor tells them that everything looks fine, they feel better in the short term. But they notice the symptom again, and then it causes their anxiety to increase. And so what they have to do is to check or seek reassurance again as a way of trying to control the anxiety. So when the reassurance seeking or checking starts to take a role of trying to control anxiety, this becomes extremely problematic. You see, the thing is that we as human beings are actually pretty logical and rational creatures. It may not always feel that way, but it's actually true. What happens as a person does more and more of this checking and reassurance seeking is that they're giving themselves a message about their health. Think about it. If there was nothing wrong, if I had nothing to be concerned about, Would it make sense for me to constantly check this same symptom or repeatedly go to my doctor to get a checkup about this particular symptom? No, of course it wouldn't make sense if there was nothing wrong. So you see, the act of repeated checking and reassurance seeking signals to me the message that there's something seriously wrong. And that's why I'm doing all of this checking and reassurance seeking. It's kind of faulty logic, but it's part of what the health anxiety does to make a person feel even more anxious. Now, the other thing that can happen with this is that sometimes efforts to check for an illness can actually bring on new or more intense symptoms themselves. So, for example, if I'm worried about a bump on my skin, I may poke and prod at it with my finger to see if there's any areas where it's particularly tender or any areas where it's sore. If I continue to do this, the more I poke and prod this bump on my skin, the more tender and painful to the touch it's actually going to become, which now makes me feel even more anxious because this bump that was there a week ago that wasn't sore or tender is now getting quite sore or tender to the touch. Another example is if I'm worried that I might have throat cancer, I might try swallowing to check and see if there's any pain with swallowing. And I may do this repeatedly, maybe 3, 4, 5 times. I encourage you to try it. See what happens if you swallow repeatedly for 20 or 30 seconds. What you'll notice is that the more you're swallowing, the harder and harder it becomes to actually swallow. So if I'm doing this swallowing thing as a checking behavior, the checking behavior itself is now making the physical sensation and the symptom more intense, which just leads me to feel even more anxious because now I'm having trouble swallowing. So checking and reassurance seeking becomes problematic when they're excessive and when we start using them to try and alleviate our anxiety, because the checking and reassurance seeking is likely just going to make the anxiety worse. And now the final big factor that tends to fuel and drive health anxiety relates to avoidance and safety behaviors. Avoidance and safety behaviors are different than checking and reassurance seeking because in checking and reassurance seeking, those behaviors are designed to reduce feelings of anxiety that are currently present. Whereas avoidance and safety behaviors are things that we do to try and prevent ourselves from experiencing anxiety in the first place. So we might do things to avoid all of the various triggers that I talked about in a previous video. This could be avoiding internal triggers, like anything that may bring on a physical sensation. So I might avoid drinking coffee, I might avoid exercising, I might avoid eating spicy food, or I might even avoid having sex. The idea behind this avoidance is that I'm trying to avoid bringing up any physical sensations that I might find scary or frightening. I might also avoid external triggers, such as people, places, or situations that might remind me of my health anxiety. So I might avoid seeing my doctor. I might avoid following up on test results. I might avoid watching medical shows on TV. I might avoid watching the news or reading the newspaper just in case there's a story about some health condition that I'm concerned about. So all of this avoidance is designed to eliminate or reduce the number of reminders that I'm experiencing about my health concerns. And if I'm reminded less, I'm going to feel less anxious or worried about it, right? However, there are a couple of main problems with avoidance. First of all, avoidance begins to make your life and your world a lot smaller because you have to avoid more and more things that might trigger your health worries. And the second problem with avoidance is that if you're always avoiding everything that you're fearful of, you never get a chance to disprove that what you're afraid of could actually happen. So if I'm avoiding seeing my doctor because I'm concerned that my doctor is going to give me bad news about my health, I'll never know whether or not my doctor would actually give me bad news. Maybe if I made the appointment and my doctor checked me out, my doctor might tell me that everything looks perfectly fine. But I never get that information because I'm avoiding my doctor. Now, safety behaviors are a more subtle form of avoidance. So with safety behaviors, you don't fully avoid something, but you only come into contact with it as long as you have a safety or backup plan. So for example, if I'm fearful of having a heart attack while hiking, I might still decide to go for a hike, but I'm going to make sure that I go for a hike with my friend who happens to be a physician, and I'm going to make sure that I have my cell phone with me just in case I start to have a panic attack. I'll be able to call for help. So I have my friend with me who's a physician who'd be able to help me if I have a heart attack, and if I do have a heart attack, I have my cell phone and I'll be able to call for help. So just like avoidance, the safety behaviors are just reinforcing this underlying belief and assumption that I'm at great risk of something bad happening, which just perpetuates my anxiety about my health. So those are the 5 main factors that tend to perpetuate and drive health anxiety. Unhelpful or catastrophic thinking about your health, an associated increase in physical symptoms of anxiety, focusing on the physical symptoms, checking and reassurance seeking, and avoidance and safety behaviors. So if you're having anxiety about your health, I encourage you to reflect on any of these factors that might be contributing to your health anxiety. Do you tend to think in overly catastrophic ways about your health? Do you tend to interpret physical signs of anxiety as a sign of something more serious or sinister? Do you tend to pay really close attention to physical symptoms in your body? Are you often engaging in checking and reassurance seeking from your doctor? Do you tend to avoid things that might bring on physical sensations that you're fearful of? And if you notice yourself doing any of these things, think about ways in which you can alter the way you're thinking about that or change the way you're behaving as a way of interrupting these negative feedback loops that just drive and perpetuate your health anxiety. If you want to learn more about health anxiety, I'd encourage you to check out this video. And that's all for today's video. Thank you for making it all the way to the end of this video, and I'll see you in the next one.